it's the evening and we'll respect everybody's time. We'll go ahead and get started. So welcome everybody. Ashley, do you want to kick us off?
Sure. Hi, everyone. Thank you for being here tonight when I know there's so much going on in our country right now, and I'm sure everybody's kind of distracted with everything else going on, but thanks for being here tonight. I see a lot of you have been on a couple of these calls or on work groups with us. We've been working, and I'm kind of looking through this list, we've been working on these new changes to marijuana licensing that occurred in 2019 at the state level. We've been looking at how we in Denver want to apply them in our community. We've held numerous meetings with a number of you guys have been involved in these, but we heard from a couple of community people who reached out specifically, and I see a few of you on here, but also wanted to have an opportunity, or who may or may not have known everything that was going on, wanted to have an opportunity to really kind of flesh out some of the issues from the community perspective. So we're excited to have everyone here, and we've got the whole team here, and you guys know Molly, she started off, but maybe we can go around. I see you in this order. I see Abby first. So maybe Abby, if you want to introduce yourself, and then we'll have everyone else introduce themselves.
Sure. Hi, everyone. I'm Abby Borchers. I'm a policy analyst with the Department of Excise and Licenses.
I'm Erica Rogers. I'm also a policy analyst with Excise and Licenses.
My name is Joey Pena. I'm a cannabis process navigator for the Department of Excise and Licenses.
All right, and I'm Molly Duplashane. I'm the Deputy Director of Policy for Excise and Licenses. So just a couple of kind of how tonight's going to work and some housekeeping stuff. We have a presentation that we're going to go through, so we'll plan on going through that from start to finish. There is a Q&A, and so if you have a question that you would like to ask, feel free to put it in the Q&A. If it's one that we can address quickly, we will try to get an answer to you tonight. If not, we have compiled some questions that were asked in previous feedback sessions and have posted those online, and so anything new that gets asked tonight that we are not able to address either live in responding to the question tonight or in a typed answer, we will post into that Q&A that is online and add to the one that's already existing. There will be time for public comment at the end of the presentation. So if you would like to participate in that public comment, you can just use the hand raise feature. And that will put you in the queue, and we will call on you and go through those. And as we get to you, one of us will promote you to be a panelist, and you'll be able to have time to speak with audio and video if you like. And then we'll move on to the next speaker. So using the hand raise feature if you would like to provide public comment at the end, but feel free to use the Q&A feature if you just want to ask a question as well. So with that, I think we can go ahead and get started. So as Ashley mentioned, we have a package of bills that we're going to be bringing forward to City Council sometime early this year. And we're with the stage that we're in right now is just taking feedback from all of our various stakeholders, and so presenting the information and taking feedback before we bring that forward to City Council. We want to provide this continued opportunity for feedback on this draft language that we have, and so tonight is a great opportunity. We've had 2 sessions previously, and we'll be continuing to take feedback up until we present that to City Council, and then there's always opportunity during the legislative process to provide feedback as well. So several goals for implementation that we just wanted to lay out as we kind of set the stage and give some background around why we're here. First of all, we've been making sure that everything we look at in the city of Denver is viewed through an equity lens. And so that has really been the core and central focus of the discussions that we've been having. At the same time, we want to make sure we're meeting the needs of the residents, businesses, and visitors of Denver. We also want to make sure that what we implement is thoughtful and reasonable and operational. And then we also want to ensure that we're still meeting the health, safety, and well-being needs of our city. As for the goals for implementation, we want to adhere to Denver's values around equity and social justice. We want to decrease barriers to entry in participation in the cannabis industry and explore financial, technical, and criminal justice support opportunities. At the same time, there were some new state licenses that were created in the 2019 legislative session. And so this gives us an opportunity to provide those new ownership opportunities, look for opportunities for innovation and expansion and creativity for entrepreneurs that want to do business here in Denver. Not only are there opportunities in this proposal for ownership opportunities, but also for consumers as well for increased access and responsible use for adults over 21. We want to be able to make sure we're maintaining strong protections that we've had in place since the very beginning of marijuana legalization in Denver that are there for youth and neighborhoods, as well as continue the community investment through marijuana tax dollars to help people who are harmed by marijuana prohibition. So that's just kind of the high level goals of this proposal. This is a summary of the legislative bills that we'll be working through, that we'll be sending through City Council. There's 3 different bills, and the topics that are incorporated in each of those bills are identified there in that middle column. The first one is really the largest bill, and it's kind of the combination of a lot of different information and a lot of different changes. This is the first topic that's included in there is social equity and developing a social equity program for cannabis licensing in Denver. This was really where we wanted to start and where we wanted to put most of our focus to make sure that everything that came after that applied that same social equity lens and utilized the same social equity foundation. At the same time, we'll be making some changes to existing licenses, first of all, using that social equity program, but then also there were some changes that were made in the Sunset Bill passed at the state a couple of years ago, and this is just a good opportunity to take the time to align the language in our code with the state's code. And so there's some pretty small technical just language changes that are included as well. But another one of them is just looking at how licenses for store and cultivation are distributed in the city of Denver. So looking at that location cap and lottery requirements that had been established in Denver a couple of years ago. As well, because marijuana delivery is part of an existing license, either a transporter license or a store license, this omnibus bill also includes the creation of the marijuana delivery program, which was a new license created at the state in 2019, but is now included in this proposal as an opting in for Denver. The second bill is to enact a marijuana hospitality program. This was which is basically a consumption license. This is another legislative change that was made at the state in 2019, and this creates that same program in Denver, allowing for lawful consumption of marijuana at licensed establishments. And then once that hospitality program, a more robust hospitality program is established, then we would introduce the bill to repeal the cannabis consumption pilot program, which is currently our designated consumption license program, which was a citizen-initiated ordinance that was passed in 2016. And much of that would be replicated in the hospitality program, and then this one would be removed in order to be consistent and have just one license on the books. To provide some background and context on just kind of the marijuana policy timeline in Denver, I'm sure several of you are aware of this and have lived it with us. So since in 2010, Denver began licensing medical marijuana businesses. Shortly after, in combination of when the state started licensing and regulating medical marijuana businesses as well. It was in 2012 that Amendment 64 passed, and all the work that led up to 2014, January 1st of 2014, when we began licensing retail marijuana businesses in Denver. As a part of that legislation and a part of that policy, there was a transition phase that was included that allowed previously existing medical businesses to add or convert to retail. And those were the only new businesses that were able to add retail, were the ones that were previously existing and in good standing for medical. That transition phase expired at the end of 2015. It was a 2-year transition phase. And so at the end of 2015 and in the beginning of 2016, Denver City Council established a permanent moratorium on some medical marijuana licenses and then established a citywide cap on certain retail marijuana businesses, specifically cultivation facilities and store retail locations. And so that was established in May of 2016. And that has still been in place up until it still is in place. In 2018, Mayor Hancock attended the U.S. Conference of Mayors, and a big topic of conversation at that conference was equity, social equity within the cannabis industry. And so we started looking, under his direction, we started really looking at how to develop a social equity program for the marijuana industry in Denver, which included looking at things from expunging convictions, old convictions that were on people's record, as well as applying a social equity program to our licensing infrastructure. In 2019, there were several changes made at the state, which I've mentioned, included restructuring the state codes, which was that sunset bill that I mentioned, as well as new license types, including delivery, hospitality, and the accelerator license. In 2020, as we kind of evolved through all of this process, we calculated and published the citywide cap, which was based on the ordinance that was passed by City Council in 2016. And we postponed the lottery for distribution of those licenses until 2021. And the reason for that was because we wanted to do all the work that we have since done to think about how we could apply a social equity program to cannabis licensing. Finally, and to where we are today, to proposing a package of bills designed to establish that equity program for marijuana licensing. We want to align our code with state law as well as authorize delivery and hospitality. To give you some background on some of the outreach and preparation and research and work that's been done to leading up to this point, in 2019 and really starting in 2018, we started having some more informal conversations about this topic of social equity within the cannabis licensing industry. And so we started holding stakeholder meetings and just individual meetings and talking with interested stakeholders to learn as much as we could about it. At the same time, there were several other states and jurisdictions that were launching their own equity program, and so we began tracking and monitoring those programs. Some of the ones that were being established at that time that we've been continually tracking and monitoring are ones in LA or in the state of Illinois and the state of Massachusetts. And like I said, we just wanted to make sure we were participating and having these conversations and learning as much as we could. So we had panel discussions at our marijuana management symposium. We participated in several rulemaking work groups that were held by the State Marijuana Enforcement Division. We've participated on the Black Cannabis Equity Initiative and other podcasts and other conversations just to make sure that we're learning as much as possible as we can about this topic and making sure that it's informing our policy. In 2019, we also commissioned a study to learn kind of what our existing market looked like in Denver. This study included several different forms of outreach, including interviews and stakeholder sessions and public forums and an online survey. And it gathered a bunch of information for us to kind of have a baseline of where we were starting. And then finally, in 2020, we assembled the marijuana licensing work group. It was a diverse work group that met 5 times, twice in May, twice in June, and then once again in September. It was made up of several different social equity experts, Denver City Council members, city and state regulatory agencies, law enforcement, and then industry representatives as well. Each of those meetings provided opportunity for public and written comment, and they were all recorded, and the minutes and the recordings are still posted online. And really all the information that was gathered through all of these different mechanisms over the last couple of years is incorporated in the proposals that we'll be going over today. So that's the background and information. And I'm going to pass it over to Erica to go over the details of the omnibus bill.
All right, thank you, Molly. So the omnibus bill is the biggest of the three bills that Molly mentioned. So it does quite a few things. So we'll go through each of those pieces one by one. As Molly mentioned, the main thing is that it focuses on equity. We are making revisions to our marijuana code using an equity lens that creates opportunities for social equity applicants. Another big thing that the omnibus bill does is align our Denver marijuana code with the state of Colorado marijuana code when it comes to formatting, content, terminology, trying to make our code as consistent as possible for transparency and ease of readability for citizens and licensees. Another big thing that the omnibus bill does is reimagine license distribution. So this falls under that equity lens, but one of the key features of our current marijuana ordinance is that there is a cap and lottery system for distribution of certain license types, namely storefronts and cultivation centers. Instead, we are wanting to be more intentional about how we distribute licenses in a way that is equity driven. So we're looking at replacing that cap and lottery with licensing exclusivity for social equity applicants. Finally, this bill would authorize marijuana delivery in line with the state's delivery program with exclusive opportunities for those social equity applicants. So we'll go through each of those things more in depth next. Before we do that, let's go a little bit high level. Many of you on this call are familiar with the history of marijuana policy in this country, especially in Colorado, one of the first states to legalize. But a big question that somebody might ask is why is there a focus on equity in marijuana regulation? I think a lot of people are familiar with what's called the War on Drugs. This was a series of policies and enactments, both at the federal level and across the country, that focused on, prosecuting possession and other crimes dealing with controlled substances. In 1970, Congress passed the Controlled Substance Act, which outlawed cannabis and other drugs in the United States. The next year, then President Nixon declared drug abuse public enemy #1. And in the years to follow those declarations and legislation, the Anti-Drug Abuse Act allocated millions of dollars to drug law enforcement and established practices in criminal justice, such as mandatory minimums in drug offense sentencing. So the effects of these public policies, as we've seen over the decades of measuring outcomes and impacts of the policy, criminal justice data has shown that those arrests and convictions as part of that policy have overwhelmingly negative impacts on a person's economic, educational, and health-related opportunities. These arrests, these convictions for low-level crimes impaired people from being able to achieve certain goals, follow certain dreams, and have the same opportunities as their fellow citizens. In addition to that negative impact of the policy, we've seen that drug policies, especially of this nature, have been enforced in a discriminatory manner. This isn't something that is unique to Colorado or even Denver. This is something we've seen nationwide in certain areas of the country, that certain communities are more targeted than other communities when it comes to enforcement. What that means is that those negative impacts of that drug law enforcement disproportionately impact distinct communities. We know which communities they are. For example, communities of color, communities that are experiencing socioeconomic hardship, communities that have historical inequity and have been targeted in other ways by other policies. All of that compounds those negative effects of the policy. So knowing all that, what are our goals for equitable regulation of cannabis and marijuana here in Denver? Our goal is simple. We want to provide opportunities to individuals who have been harmed by the war on drugs and the marijuana prohibition or by historical inequity. And we want to lay the foundation for equitable wealth creation by removing barriers to entry into this industry. So this slide takes a look at the impact of early regulations on the equitable nature of the marijuana industry. Certain things that were designed to meet other goals as the industry was developing actually led to additional inequities or barriers into the industry. Some of those included those federal law restrictions on controlled substances. Those necessitated strict state regulations when Colorado and other early adopters were looking to legalize cannabis. Those strict laws resulted in a need for significant technical expertise. So applicants looking to start a business in this industry needed to consult various kinds of experts, business consultants, attorneys, architects, people who really had high rates for their specified services. In addition, those initial laws legalizing cannabis created no provisions for what we consider equity today. At the time those discussions were being had, many felt that legalizing itself was an equitable move. And as we've evolved over the past 7 years in Colorado since legalization, we're starting to see how those conversations are changing and evolving. In addition, when the recreational market opened up, individuals with certain convictions were not able to work or buy into ownership in the industry, especially in Colorado. So if you had a criminal background for being targeted for one of those crimes, you couldn't then get into that industry. Finally, requirements about vertical integration, property leasing, other things like that resulted in high entry costs. So all of these things created barriers to the marijuana entry or to the marijuana industry, in addition to those historical inequities. As Molly mentioned, we did try to look at our ordinance as it exists through an equity lens. And this is something that the mayor talks about a lot. He wants everyone in the city to use an equity lens when developing policy. But I think a lot of community members still are unclear, what does that mean, an equity lens? So what it means is looking at things and asking yourself as you're developing the policy these questions and having critical conversations with your teammates about the answers that you get as you're exploring policy options. Some of those questions are: who will benefit from the decision? What are the associated burdens or unintentional impacts on any given demographic? What are the disparities that are addressed by the decision? And then how can the government document our action steps to correct any burden of unintentional impact connected to those key decisions? So we wanted to highlight those questions that we were thinking about as developing the policy. So with that background, we'll jump into what the specifics of the equity program are that we're proposing. First and foremost, we've got the definition of who qualifies as a social equity applicant. Once we figure out who the applicants are, then we can talk about the opportunities available to them. So our proposal is to adopt the same definition that the state of Colorado has adopted for a social equity applicant. And that would be a person who is first and foremost a Colorado resident, who then either on their own or together with other social equity licensees owns at least 51% of a proposed marijuana business, has not had an ownership interest in a marijuana license that has been the subject of licensing authority action or legal or disciplinary action against that license that results in revocation. And then that person can demonstrate one of the following in that middle category there. So in that middle category, there are 3 ways that this person can meet that social equity definition. One deals with where that person lived, one deals with the person's criminal history, and one deals with the person's income. So that first way, dealing with where that person resided, the criteria is that they had to have resided 15 or more years between the years 1980 and 2010, within an area that's either defined by the state OEDIT as an opportunity zone or by the state marijuana enforcement division as a disproportionate impacted area. So the state has actually released a tool on their website where you can type in your zip code and figure out if you fall into one of these areas. So that is a great resource if you follow the link there. The second way that a person could qualify as a social equity applicant is whether they or their immediate family member has been arrested, convicted, or suffered civil asset forfeiture due to a marijuana offense. The third and final way is whether an applicant's household income exceeded 50% of area median income as defined by the state. So there's several different ways. You only have to meet one of them to qualify as a social equity applicant. Once you qualify as a social equity applicant, then there are several opportunities that we're proposing in our bills for those applicants. The very first one is a licensing exclusivity period of 6 years for most of our marijuana licenses. This includes stores, transporters, cultivations, manufacturing, as well as hospitality, mobile hospitality, and hospitality and sales. The thinking behind this is that in Denver, there were 6 years for early adopters to get into the industry before there was any kind of restrictions. So offering that same amount of time to our social equity applicants exclusively will allow them a similar opportunity to get into the market. In addition to that 6-year exclusivity, we are also proposing transporter delivery exclusivity for 3 years. This means that while the state has allowed stores and transporters to conduct deliveries, we would limit deliveries to be conducted only by transporters for a period of 3 years before stores could also do that. The thinking behind this was to provide an opportunity for social equity applicants, not just to enter an industry that's already been established, but to provide them a path to establishing this sector of the industry that's new and allowing them to pave the way for how that's going to look for future licensees. Another key piece of our equity proposal is offering reduced fees for certain license types. That would be a 50% reduction in license and application fees for stores, transporters, cultivations, and MIPS. Those are our existing licenses, MIPS being manufacturing facilities. We're also looking at lower licensing fees for those new license types, delivery and hospitality. Because we've heard from so many entities that access to capital is so key, especially for social equity applicants. This is a way that the city can cover half of the cost of our existing license types and reduce the burden of that capital raising feature that's in our control. Here are some other key pieces of our equity program. Now, you might not see some of these explicitly laid out in the bills because they're not legislative in nature, they're more programmatic. But we wanted to highlight what else Denver is planning to do as part of our social equity program. First, we are ensuring that those social equity applicants who want to enter the business through the accelerator program at the state are able to do that into the local market. That is one way they can be licensed as a social equity applicant. In addition, we're looking at resources for process navigation. So understanding that many of our social equity applicants, this may be their first time interacting with our department, this may be their first time applying for a business license. And so making sure that we're providing that applicant-centered guidance for navigating the process, knowing the steps, and providing education. That education would be a key piece that we would do in partnership with our community partners, such as industry associations with technical expertise and law firms with the legal expertise to facilitate those licensing workshops and business development support for our new applicants who, again, this may be their first time interacting with the department in this capacity. Another key feature that we're exploring is additional avenues for financial support. In addition to waiving half of that licensing fee for our social equity applicants, we're interested in and currently exploring creation of local grant programs or loan programs. We're also supportive of efforts to advocate for state level funding of local social equity programs. We look forward to hearing more about that. And we're always open to suggestions from industry members on how they can support social equity applicants as well. So let's hop into the omnibus changes in addition to the equity program that you'll see in the marijuana code. So some of the basics, you will see a migration of the medical marijuana provisions from Chapter 24, which is a health code, to Chapter 6, where our retail marijuana provisions are already located. This is mirroring a change at the state where instead of having a retail code and a medical code and repeating some of those provisions twice, we're migrating them into one single code that highlights where the similarities and differences are based on license type. In addition, we'll be aligning our code with the state code by incorporating that parallel terminology. So for example, a medical store used to be called a medical marijuana center, whereas the retail version was called a retail store. Now they're just differentiated between medical or retail marijuana store. Things like that you'll see us adopting as well. And as far as the remaining provisions, we have combed through them. Some changes are, technical in nature, but a lot of them are done in an effort to clean up language that ensures that the code can be read through an equitable lens. One key area of provisions that we wanted to highlight are youth protection regulations. So these are regulations that are in place in order to ensure that our youth in Denver are not developing negative youth perceptions about marijuana or habits when it comes to marijuana consumption. And according to our health partners, we've identified at least 3 areas that are super important to impact on youth usage and perceptions. Those fall into the buckets of advertising, density or the clustering of outlets, and then the proximity of those outlets to other types of uses. So when it comes to advertising, we will be maintaining our current advertising restrictions that are in the current code. There is a exemption that for branding that the state has designed at the legislature. However, we will not be opting into that to allow for outdoor billboards or anything like that. That little star there indicates as much as we're trying to align with the state, there are a few key areas where we will be tweaking our code. So we've highlighted those with stars. The next section on density, that's that clustering of outlets. The current code as well as the proposed code maintains that prohibition on any new store or cultivation locations, whether new or transferred, in the top 5 most saturated neighborhoods. This is to prevent further saturation in those neighborhoods. The proposal also maintains the director's ability to consider density whenever she's issuing or denying a license, and it maintains that 1,000-foot buffer required between store outlets. When it comes to proximity, we are also proposing to keep all of our current proximity restrictions for all license types. However, we are proposing an adjustment for how we measure proximity for certain types of outlets, including drug and alcohol treatment facilities, city recreation centers, and outdoor pools. The reason for this is simple fairness. We were noticing that certain areas of the city that were less dense were receiving more protection than other areas that maybe were more dense, just based on the way we were doing the calculation of the measurement. By using the measurement between the proposed outlet and the building used for that purpose, that will ensure a fair measure of proximity across the city. The next key piece we'll talk about is replacing the current cap and lottery system for distributing licenses. So as a refresher for anyone who needs it, the location cap is a numerical cap on the number of retail marijuana store or cultivation licenses that may be issued within the city. The ordinance currently has a formula for calculating the caps, which were published last year by the department. The ordinance then requires that the department hold a lottery in order to distribute any licenses for locations that are underneath of that cap. And that is where the current protection for the top 5 most saturated neighborhoods exists. So what we are proposing is replacing that cap, removing that numerical cap, and replacing it with the licensing exclusivity for social equity applicants. When it was initially drafted, the cap was intended to protect those communities from oversaturation. We will be maintaining those protections. But what we have learned from both our research in Denver and in other jurisdictions is that that numerical cap can exacerbate inequities that are present, whether it's in the zoning code or whether those inequities are historical. And what that does is result in a scarce number of available locations that drives up artificially the cost of existing licenses. So we're hoping that by removing the cap and then eliminating the lottery as the process for distribution, we can instead move away from a system that leaves the distribution of licenses up to chance and be more thoughtful about a method of distribution that is specifically geared toward issuing licenses to the social equity applicants who were previously denied entry into the industry. That said, one piece of the cap and lottery proposal that we do want to keep is that protection for the 5 saturated neighborhoods. This will help our goals around density, help to desaturate some of those neighborhoods. And in fact, we're going to expand the protections in our proposal The current bill, the current ordinance protects those saturated neighborhoods from new store or new cultivation facilities. However, our proposal also will protect those neighborhoods from transfers of location into those same neighborhoods. So it's not just new licenses that will be prohibited from locating there, it will be transfers of existing licenses as well. Some other key features of our changes include the requirement of a social impact plan to be submitted with applications. This is an improvement on our existing community engagement plan. We piloted this change with our research and development license that passed last year. We're hoping that this improved plan does a couple of things. First of all, it expands the amount of information that an applicant is providing about their impact on the community around them. So in addition to discussing what that applicant's plan is for dealing with neighborhood complaints, the social impact plan will also discuss the applicants, any practices they have or plan to enact for diversity and inclusion in hiring and employment or environmental sustainability. In addition to providing more information, we're also going to require that the plans be publicly available and also reported on annually and shared with RNOs so that they can have that information about the kind of actor that is in their community. This will improve the public process by giving them more information if there is a needs and desires hearing or a renewal hearing, as well as highlight some of the wonderful things that our licensees are doing in their communities. In addition to the social impact plan for hospitality licenses, we will be requiring evidence of community support. This is a requirement that is a holdover from the citizen initiated ordinance. And it's just a requirement that the applicant talk to the neighborhood where they want to locate and get some sort of support or non-opposition from a registered neighborhood organization or bid in order to apply for the license. Finally, a change that you won't see in the ordinance because it's not legislative, but is part of our package geared toward equity, is to look at the method for licensing hearings. And if there is no filed opposition to a license application, allowing it to be heard in a docket style hearing where the resources needed by the applicant to go through that hearing procedure are less burdensome, while still maintaining the protection for the neighborhood to speak if they so wish. Some other key changes you'll see in the omnibus are a change in the allowable hours of operation. So shifting to align with the state again for retail stores and shifting from hours of 8 a.m. to 10 p.m. to 8 a.m. to midnight. So this gives social equity applicants and licensees some additional flexibility with their hours of operation. This will allow them to meet the needs of the market, either created by delivery or, as we're seeing in a post-COVID world, just the market changes evolving anyway. To pair with that, there are some additional safety requirements in the bill, including a requirement that stores remove product from the sales floor and secure it in a safe or vault at night. This has been a successful route of regulation in Aurora. So this is something that the police department has recommended as an anti-burglary feature. Another thing you'll notice about the ordinance is that we are moving away from putting detailed application requirements in ordinance. This will allow us to be flexible, not just with marijuana licenses, but with all licenses, that as we collect data about the types of information that we do or don't need from an applicant when processing their application, we can adapt that application to be flexible to meet the needs of the community. Finally, you'll see some fee changes. These are to account for the amount of work it takes our department to process these types of applications, including a transfer of location, especially those that require a hearing, modifications of premise, and transfers of ownership. So with that, I will hand it over to Abby to talk about the delivery program portion of the omnibus and the hospitality bills.
Thanks, Erica. Again, I'm Abby Borchers. I'm a policy analyst with the department. I'm just going to run through the delivery and hospitality pieces of our proposal. So in 2019, the state legislature passed a bill allowing for marijuana delivery in Colorado. So licensees that can obtain a marijuana delivery permit are medical and retail marijuana stores and medical and retail marijuana transporters. And transporters may conduct deliveries on behalf of stores. So in our proposal from 2021 until 2024, July 1, 2021 until July 1, 2024, only transporters would be allowed to conduct deliveries, and they would have to do so on behalf of stores. And those transporters would have to qualify as a social equity applicant in order to obtain a Denver delivery permit. After July 1, 2024, both transporters and stores would be allowed to conduct deliveries regardless of their social equity status. Some basics about marijuana delivery. A customer or patient has to be 21 or older to receive deliveries. And delivery can occur from 8 a.m. until midnight. Those are in alignment with the state's hours of delivery. And then the amount of product that can be delivered to a home is the same as the amounts that could be purchased in a store. So for medical, that's 2 ounces of marijuana, 40 grams of concentrate, and marijuana products containing up to 20,000 milligrams of THC. And for retail, that's 1 ounce of marijuana, 8 grams of concentrate, and marijuana products containing up to 800 milligrams of THC. Delivery drivers must check a consumer's ID before transferring marijuana to the consumer. In addition, we are proposing requiring that delivery drivers use an ID scanner to verify a consumer's age. And all legal forms of payment would be acceptable, including online payment. Additionally, we are proposing that delivery drivers would not be allowed to accept cash tips. Both of these are just additional safeguards to protect against diversion of marijuana to youth through delivery, on top of the security and safety regulations that the state has put into place. So just a few of the security requirements at the state level that we would be aligning with are that video surveillance must record at least the front view of the vehicle, as well as the secure storage compartment that holds marijuana inside the vehicle. And that footage must be retained for a minimum of 40 days. Enclosed delivery vehicles would be allowed to contain up to $10,000 in retail value of marijuana, and non-enclosed delivery vehicles would be allowed to contain up to $2,000 in retail value of marijuana. In addition to that, we would require that delivery drivers keep receipts in the vehicle. Delivery orders can't be placed in the vehicle until an order has been placed for them through the store. And so we want to make sure that our law enforcement has the tools they need to verify that the marijuana inside the vehicle has been ordered properly and is from a regulated source, and also meets those inventory limits that I just described. So where can marijuana delivery occur? Marijuana can only be delivered to a private residence that's located in Denver, or a private residence that's located in another Colorado jurisdiction that has affirmatively opted into marijuana delivery. Delivery is prohibited to any jurisdiction that has not affirmatively opted into delivery, or that has prohibited delivery into its jurisdiction from outside. Delivery also cannot occur at a school or on the campus of an institution of higher education. Delivery cannot occur on public property or any commercial properties such as offices or retail space. And then delivery cannot occur to a consumer or a private residence where the licensee knows that the consumer or private residence has already received a delivery that same business day. And in addition, we are proposing adding that delivery cannot occur at a drug or alcohol treatment facility. These are our proposed permit fees for delivery permits. The one-time application fee would be $1,000. The annual license fee would be $2,000, and then a transfer of location would be $1,000, and a transfer of ownership would be $250. Okay, next I'll run through the hospitality bill. So this bill would align with the state's marijuana hospitality license that was created by the General Assembly in 2019. This would allow for marijuana consumption establishments with smoking and vaping options. And then this bill also maintains strong protections for youth that we had in place for the cannabis consumption license that was created by Initiative 300. So just a little background of marijuana consumption laws in Denver. In 2016, Denver residents approved the Denver Cannabis Consumption Pilot Program when they passed Initiative 300. In 2017, the Department of Excise and Licenses adopted agency rules to supplement the citizen-initiated ordinance. And then in 2018, the first cannabis consumption license to allow for adult consumption of marijuana in designated consumption areas was issued in Denver. And then in 2019, the General Assembly passed House Bill 19-1230, which created 2 types of marijuana hospitality licenses. And then in the summer of 2019, the Colorado Marijuana Enforcement Division adopted their agency rules to implement the statute. So there's 2 main types of hospitality licenses. The first is a marijuana hospitality establishment, which allows for consumption of marijuana by adult patrons within a permanent fixed license premises. And in this model, patrons bring their own marijuana and sales of marijuana are not permitted. So this is the most similar to the current model that we have under Initiative 300. A subset of a marijuana hospitality establishment is a mobile marijuana hospitality establishment, which allows for consumption of marijuana within a mobile licensed premises. The mobile premises must be a vehicle, so this could be something like a shuttle or a tour bus. And again, this is a bring your own model. No sales of marijuana are permitted. And then the other type of hospitality license is the marijuana hospitality and sales establishment. This allows for on-site consumption of marijuana that has been purchased on the premises. So sales in limited single serving quantities are allowed. And again, this is a permanent fixed location, not a mobile premises. So a few basics about a marijuana hospitality establishment. A patron has to be 21 or older to enter all types of hospitality establishments. Our proposed hours of operation are in alignment with the state, so 7 a.m. until 2 a.m. The state legislation allows local jurisdictions to opt in to an exemption from the Colorado Clean Indoor Air Act that would allow indoor smoking and vaping of marijuana. And we are proposing opting into that exemption so that people can smoke and vape indoors as long as they have the proper odor and ventilation controls. In addition, we are considering prohibiting the use of LPG torches, liquid petroleum gas torches, and butane lighters at all hospitality establishments. So some of our local requirements that we are proposing in Denver are a prohibition on overlapping premises. So a hospitality establishment would be prohibited from allowing their licensed premises to overlap with the licensed premises of a medical or retail marijuana store. So they could be located next to each other, but not on the same premises. Also in Denver, an odor control plan will be required for all types of hospitality establishments. And then a public hearing, a needs and desires hearing will be required for all hospitality establishments unless the hospitality establishment is mobile, simply because a mobile hospitality establishment wouldn't have a specific neighborhood. So some different ways that a hospitality establishment could look. They are allowed to have outdoor consumption areas as long as the outdoor consumption area is surrounded by a site obscuring wall or fence or other barrier. And we would require that outdoor consumption areas comply with existing Denver odor regulations as well as ventilation requirements if applicable. Hospitality establishments can also be located inside a retail food establishment. So the hospitality establishment has to be separated from the rest of the retail food establishment by a site obscuring barrier and a secure door, and their operations cannot overlap, and marijuana cannot be added to food that is served in the RFE. So in addition, consumption areas in a retail food establishment would be required to comply with Denver odor regulations and ventilation requirements. We would propose keeping the proximity restrictions that we had in place for the designated consumption area license and applying those to hospitality licenses. So you can see in that second column there in bold that the proximity for hospitality would be 1,000 feet from schools, 1,000 feet from childcare facilities, 1,000 feet from city pools and rec centers, 1,000 feet from alcohol and drug treatment facilities. And then in addition, we would require that they are 1,000 feet from other hospitality establishments. So this is similar to the 1,000 foot buffer between stores and centers. Hospitality establishments would also have to be 1,000 feet from each other, just to prevent undue density of those outlets. So a few more specifics about mobile hospitality. So again, this is the shuttles and tour bus models. They are required to have GPS tracking of the mobile premises, and they have to have route logs that are logged in accordance with their standard operating procedures. And then in Denver, we would require that the applicant supply our department with information about their planned route, including any stops. And then they would be prohibited from allowing consumption if the vehicle is stopped at a location for more than 30 minutes. So this just reinforces the fact that this is a mobile hospitality business. It can't be, parked outside an event for hours or parked, in any location for more than 30 minutes, unless it's not in operation. And then for that hospitality and sales model, which is the on-premises consumption of marijuana purchased on site, the limits for sales are roughly a single serving size. So 2 grams of marijuana, a 0.5 gram of marijuana concentrate, and then marijuana products containing 20 milligrams of THC or less. So these are our proposed license fees for hospitality businesses. The one-time application fee of $1,000, annual license fee of $2,000, and then transfer of location of $1,500, a transfer of ownership of $250, and $300 for a modification of premises. So the third and final bill in this package is a bill to repeal the citizen-initiated Consumption Establishment Ordinance, Initiative 300. We would plan to do that after we've enacted the Denver Marijuana Hospitality Program. This would also convert the one currently licensed designated consumption area to a hospitality license, and also make any additional cleanup that we might need to make to the hospitality bill. So I'll turn it back over to Molly for talking about next steps.
Great, thank you, Abby and Erica. So just some information about the timeline for these bills and implementation. So we're hoping that we can bring forward all 3 of these bills sometime during this first quarter of 2021 through the City Council process. That would then lead us into some implementation time. All of them would require some lead up time for us to get our technology ready, our processes prepared. So we would do that throughout Q2 of 2021, which would take us to sometime in Q3 for an effective date for these. So that is when we would start to be able to take applications for those new license types, as well as implement some of the other components of the bills. We know that an important component to this is making sure that we're tracking and monitoring whether the intended goals for each of these policies, whether we are meeting them, and we want to be able to make sure we're being able to measure our success. So we will be offering licensing opportunities exclusively to equity applicants. We'll be able to very easily track the number of applicants that were helped by the program. We'll be able to determine the number of applications that are successfully processed and number of licenses that are issued to social equity applicants throughout that 6 years where there's that exclusivity opportunity. We'll also be tracking other key information of the program as it's developed and implemented. There is some information in here as well as around reporting requirements to City Council. It requires that we report to City Council on the delivery program prior to sunset, including that 3-year exclusivity for transporters, social equity transporters. And I believe we'll be adding, it's not in the current draft language, but we'll be adding some additional requirements to make sure that we report out to City Council prior to the sunset of the 6 years of exclusivity for those other license types. There'll be lots of data that will be able to inform these policies and decisions, and we'll be making sure that those data points will be publicly available throughout that as well. And as Erica talked about, there is a new component and an expanded component to have social impact plans be a requirement. And there is a requirement also that those social impact plans will be publicly accessible for both the community and other businesses and the city to be able to access those plans and determine whether those businesses have met their goals around community outreach, diversity, inclusion, and environmental sustainability. Going up to the clip. So this one's a little bit outdated and we haven't added to tonight's session on here yet, but we did hold 2 other sessions in December. And then obviously this session tonight, and there are still additional ways to provide feedback. After tonight, we'll be still taking written comment up until we're probably through the end of next week, January 15th, although there's still opportunity to provide that written comment and feedback to us after that as well, especially in the City Council and legislative process. And so, as I stated before, there was lots of input that led up to this process and to the proposal that we have forward tonight, or that we'll be bringing forward to City Council. And so we just want to make sure that we're continuing to take feedback and incorporating changes and that feedback into our proposal before we move it forward. So written comment will be an option. There'll be a template. There is a template through these links here that's available for your convenience to provide us your written comment on all the different topics that we've presented tonight. You can also contact marijuanainfo@denvergov.org and request a meeting to learn more or provide feedback. And then, as I stated, there is the Q&A that will be available tonight or from the meeting tonight. And so there'll be answers to several of the questions that we're now able to get to tonight. All of those will be posted online, as well as the recordings from the previous sessions, tonight's recording, and the answers to the questions in the Q&A. So I think that takes us to the end of the presentation. And we will now open it up to public comment. And let's see, we only have one person that has their hand raised currently, it looks like, but there's some more coming, it looks like. So just a reminder, if there's anybody out there that would like to provide public comment, we'll do 2 minutes per person. And Abby will be our timer. And if you want to speak, just use the hand raise feature down at the bottom, and that will put you in the queue, and we'll move through those, and we'll move you to be able to have audio and video for you to provide public comment.
Okay, the first hand up is Nancy Grandis-Jones. I'm going to promote you to a panelist so that you can turn on video and unmute yourself if you'd like. It'll briefly sort of kick you out of Zoom and then bring you right back in as a panelist. So there might be a slight delay. So I'm promoting you to a panelist, Nancy.
Okay, I'm
And Nancy, oh, there you go. You're good.
okay. Well, I've a couple of questions, actually. I'm most interested in the SIP, which replaces the community engagement plan. My experience with the community engagement plan in the past is they were just pieces of paper that were filled out. And I want to understand this. How will the those be monitored? And towards the end of this presentation, it was said that, you know, they'll be public, that community groups, well, anyone could have access to the SIPs. And so my question on that is too, are we as community members supposed to evaluate those SIPs as to what, you know, the marijuana businesses have said that their goals would be? And the other thing is about that is, then it's like the CEPs, the burden was put on the community groups to actually search out those community engagement plans. I forget what the SIP is, what that stands for, but anyway, with the SIPs, is that the same thing? We are going to have to take the initiative to search these out? And do the monitoring?
So they will be publicly available. We plan to have a website where they'll be posted. But if you don't mind, Nancy, let's go ahead and get through the public comment from the other participants. I'm sorry.
Oh, okay. So this isn't a question time, not a question time?
It's a pretty simple question, which is that they will be publicly available on our website as well as the business's website. But we can go, after we get through the public comment, and there's still time because it doesn't look like we have very many people that have their hand up, we can come back and I can answer that a little more in more detail if there's still time, but I just want to make sure we get through everybody that has their hand raised.
Well, then my public comment would be that the burden not be put on community groups to go out and search for these, that just like community groups are getting notifications of, you know, when there are the public hearings, that the RNOs be sent these forms and documents, and also that the excise and licensing do the monitoring and evaluating then if the goals have been reached.
Great, thank you.
Mm-hmm.
All right, next we have Haley Dennis. Haley, I am promoting you to a panelist. Haley, are you on mute? Okay, I'm gonna move on to the next person and
Try one more time. No,
Sorry about
maybe
that.
not.
oh, there she
There you
is.
are.
Hi, my name is Haley Dennis. I am first and foremost am a student at the University of Colorado, Denver, and I am also on the Advisory Council for Smart Colorado, and I'm also a representative and alumni from the Colorado Student Leadership Institute. I'm just here to say, first and foremost, that I think a lot of the provisions in the revisions of the language in protecting youth all sound really good. I have a couple of concerns regarding extending the hours to midnight for the dispensaries. I personally feel like that with Smart Colorado, we have outlined that at 10 o'clock would be a good time to close. That is kind of the standard for businesses of operation at the moment with COVID anyway, is reducing operation hours in general. I also would really like to point out, I feel like there's not enough youth protection in terms of the delivery system. I really feel like there should be a more I feel like there should be more background in terms of fake IDs and buying for those who are underage, and then just making sure that there is no black market sell to the youth of Denver County. And I would also like to point out, or sorry, City of Denver. And then I would also like to point out that I think the 1,000 foot radius distance between rehabilitation centers should still be maintained. I know you guys talked about wanting to make it more equitable, but I really feel like that exists, that distance should exist regardless of whether or not it ends up messing with the distribution density. I really feel like the lower the density, the better to prevent oversaturation. So thank you guys very much for your time.
Thank you. Right at 2 minutes. Okay, next is Char Day. I'm sorry if I'm mispronouncing any names tonight. I'm promoting you to a panelist.
Hi, thank you so much for allowing me to give testimony here. Again, my name is Char Day, and I'm with Americans for Non-Smokers' Rights and the A&R Foundation. And I do want to thank you all for your thoughtful work on this very complicated issue for Denver, and especially so from looking at it as a social equity issue. I do have something that I'd like to bring up about health equity too. So I'm speaking on Bill number 2, and on behalf of our many members in Denver, I'm voicing A&R support for not opting in to allow for on-site cannabis and marijuana vaping and smoking indoors. Excuse me. So the current body of science shows that, like tobacco, marijuana smoke can have harmful cardiovascular effects. Smoke is smoke. Both tobacco and marijuana smoke, they impair the blood vessel functions for hearts in similar ways. So people should avoid both, and governments should protect people not only from secondhand tobacco smoke, but also from secondhand marijuana smoke. I believe that opting in for this would weaken the Colorado Clean Indoor Air Act and Denver's longtime standing as a smoke-free city. No one wants to bring smoking back indoors after years of smoke-free spaces. It would erode public health protections and jeopardize the health of Denver residents, workers, tourists, and more by permitting marijuana smoking and vaping in indoor spaces. This is a social justice issue. No one wants to see a new class of workers, those working in marijuana hospitality spaces, have to give up their health for a paycheck. So everyone deserves to breathe smoke-free air. And if Denver's committed to protecting public health and safety, then it must support maintaining smoke-free indoor air rules that protect all workers, every worker, and patrons by minimizing susceptibility even to COVID-19, which attacks the cardiovascular and respiratory system. So we encourage the measures moving forward to protect all worker health, and do not recommend that marijuana or cannabis be smoked or vaped inside any workplace, including retailers and restaurants. And thank you so much.
Thank you.
Thank you.
Okay, next is Jennifer Wright. I'm promoting you to a panelist.
Hi, can you hear me? Start my video, I
Yes.
guess, too. Hi. Thank you for all your hard work. I was really impressed with the presentation and a lot of the, equity and social justice aspect of it. I'm a parent. I have 2 kids, and I'm joining this, or I joined this because, I'm also a Denver resident. It's the youth impact, which you brought up in one of your slides, and it was pretty pretty short. But that's also my biggest concern, because from what I've seen since 2014, the youth has not really been protected. And so I just want to make sure, since you've done such a great job going back and sort of trying to redistribute and allow new people into the business who can benefit from this and new types of licenses, but let's also go back and see how can we really try to protect the youth of Denver. I mean, it is a very big problem in our schools. I know from having kids in DPS, my kids are now in college, and just talking to their friends, and the incidence of cannabis-induced psychosis is very high among our youth. And part of it is like, I'm trying to envision, like if I could go back to 2014 when we were talking about how the dispensaries would look driving around my neighborhood, driving my kids to school when they were in middle school. I wish I could go back and say that I wouldn't want them to look the way they do in terms of saying on the outside of the building, medical and recreational and the ages, because to me, that told my kids, here's where you can go for medicine. Here's where you can go for recreation. When really, like, recreation in my family is skiing and hiking. Medicine is like something that, is actually by a specific dose for what they need in conjunction with a professional. I'm not saying that cannabis can't be used for that, but not the way the youth are using it in the schools, right? So I'm trying to envision what this is going to look like, the yoga studios and the establishments and the buses, and just so that it's not this enticing, like, adult playground for them. How can we balance all the interests? And I know that they, in part of your slides, and I took a little note about, the unintended consequences, through your equity lens, like, how does the unintentional impact, right? That was one of the circles in your bubbles. Sorry, I mean, I'm new to all this, and this is my first time seeing that presentation, but to me, like, there were a lot of unintended consequences of the dispensaries, right? I mean,
thanks, Jennifer. You're at 2 minutes. Thank you. Okay, next is Laura Stack. I'm promoting you to a panelist.
Hi, okay, can you hear me?
Yes.
I don't see myself on screen, so I hope I'm on. Thanks for listening to my concern. I'm Laura Stack. I'm the founder and CEO of Johnny's Ambassadors. We have a mission to educate parents and teens about the dangers of today's high THC marijuana on adolescent brain development and mental illness and suicide ideation. My 19-year-old son, Johnny, died by suicide as the result of marijuana psychosis. He thought the mob was after him, and we are educating people about the dangers of youth use. And I want to thank the city, first of all, for the efforts that you are using to try to keep our youth safe in terms of distance, in terms of billboard advertising, in some of the other things that you're putting together. So really appreciate that. And there are some things that I think are problematic that I would like to state in our work with youth. Today's fake IDs are scannable. They do scan. Delivery drivers have no idea what fake IDs look like. They are provided by China. The students buy them in bulk, in blocks, and they do scan. And so they're very, very sophisticated. And many of the students live together in housing that they're all under 21. And you can't buy alcohol, you can't buy cigarettes, but you can have a whole group of them, many of whom I know many who have fake IDs. And it would be very simple for one or many of them to get marijuana products. Secondly, nothing good happens after 10 o'clock. I really think it's critical to maintain the dispensary hours of 10 p.m. instead of allowing them to midnight. I worry about the edibles. Many of today's youth don't understand the time delays and the impact. And I really worry about drugged driving, and many of them, half of them, admit to going out and driving. I'm also very concerned about tracking. There doesn't seem to be full tracking of the deliveries to residences. There are dorms, there are apartments, there are places where multiple underage youth live together. How will we know that they haven't received 3 different deliveries, 5 deliveries, 10 deliveries that day? I'm very concerned about the black market, as well as tipping to these drivers who knowingly will bring them drugs for a very high tip. We also have a big gap in regulation with medical marijuana licenses, and especially in high schools, who don't always have parents at home. As a senior in high school, whoever's the first one to score their medical marijuana card and pay a doctor $500 to get their card saying they have a migraine, now they become the drug supplier. And so they can have marijuana delivered to their house. And while this is really simple, now I just go around and deliver it to the rest of my high school and junior high buddies, paying a premium. So thank you for listening to my concerns. I do think the youth regulation guidelines still need some severe work. Thank you.
Thank you. Okay, next is Linda Brown. I'm promoting you to a panelist.
Unmute. Hi, thank you. I appreciate your doing these presentations and letting us have some input. I'm a community member. I live in Park Hill near Colfax Avenue, so in a pretty high impact area. I have to say I voted for legalization and probably would not do so again if I had known what was going to happen to my neighborhood. I would really appreciate your considering keeping the 10 p.m. closure time. I don't really think there's any need to extend it beyond that to midnight. And it is protective of the neighborhoods to keep it at 10 o'clock. And I don't think aligning with the state of Colorado is needed for that particular change. I also am concerned about the serving of edibles in hospitality situations, and hope that you will be very, very careful to regulate small servings. It's going to be very difficult to control. People don't really understand dosages in edibles and often do not understand the delayed impact and will go ahead and drive after consuming edibles and not realize that they haven't felt the full effect yet. I really encourage you as much as possible to keep our youth in mind. Unfortunately, kids are very ill-informed about marijuana and its effects, and anything you can do that protects children, I just hope you will overdo it rather than underdo it, because our children need your protection. Thank you.
Thank you. Okay, no one else has their hand raised at this time. Comment.
So I think I can, I just want to highlight a couple of themes that I think I heard throughout the comments, if that's okay, real quick. And maybe address a couple of questions or concerns that were brought up. So I think going back first to Nancy's question around social impact plans and how they differ from community engagement plans and how they will be accessible to community members. And so it will be a requirement that the social impact plans are made publicly available, both by the business, and then we do plan through the city to be able to create a easily accessible location where the social impact plans would be could be accessed. And so To Nancy's point around putting the burden on the community groups to find the plans, that is something that we plan to do. And in addition, for stores and hospitality businesses that have needs and desires hearings, a packet of information is sent out to the RNOs, the registered neighborhood organizations that are within the designated areas of that business. And within that packet of information will be the social impact plans. So that will be something that the neighborhood will be able to have access to and review in advance of the needs and desires hearing. And so I just wanted to highlight that piece to go back to Nancy's question. Additionally, I think there were several comments around delivery businesses and some of the youth protections that are in place for those. And so I just wanted to highlight a couple of requirements that are out there that the state already has in place regarding locations of where deliveries can occur. They can only occur at private residences. And there's some clear language around what that means and what is defined as a private residence. And so that includes that a college campus would not be a place where you could get a delivery of marijuana made. In addition, there are requirements that the state has put in place around GPS tracking of the delivery drivers and the delivery vehicles, as well as the tracking in the state's inventory tracking system, and so all the several, and it'll be very much replicated and similar to the tracking of sales and purchases and customer, individual sales by transaction, just like is in the brick and mortar and the permanent establishments that are there today. And so there is the opportunity to do that tracking through their inventory tracking system to ensure that there is not diversion into the illicit market or sales to more than one person, or the same person in more than one in the same day. And so some of those protections are in place by the state already as well. So I think those were the two things that I wanted to address. It does look like we have an additional person with their hand raised now. If we want to go to them, Abby.
Diane Carlson, I'm promoting you to a panelist.
You might be on mute, Diane.
Oh, sorry about that.
That's okay.
Okay, can you see me now?
We can, yeah.
I apologize about that. And, just Diane Carlson, I'm a co-founder of Smart Colorado, and we've been a Denver-based youth advocacy organization, and we appreciate that we've had the chance to be a part of the stakeholder meetings, and do appreciate, the protections at Denver with the 1,000-foot distances that you've kept, in place, and we are worried about the hours, and we appreciate where you've diverged from the state on some of with the billboards, and we would highly recommend keeping the hours, where they've been for, once again, to protect kids. We also think it's super important that everyone be aware that when these bills were passed at the state level, an important part of it was that jurisdictions could opt out of delivery or opt out of on-site. And so just curious to hear your thoughts at all on, will that information be presented to city council members so that they're aware of that? We know that there's a lot of jurisdictions that have chosen to opt out because of the concerns that some of the folks on this call have raised. The other thing that's super concerning, which I know others have mentioned, is the frightening amounts that can be delivered. And I know we appreciate all the protections you're trying to put in place, but those levels are extremely high with delivery, and there have yet to be any limitations on the type of products or the THC potency, which is very concerning. And as you mentioned, well, I know you're trying to figure out how to, limit the opportunity of people buying that same daily amount, either in a day, doing it several times in a day, which I know everyone's calling looping. We're really well aware that the state and the city have yet to really find ways to handle that looping problem. So that's a real concern. And again, we just really appreciate you taking the kids into consideration. And the other point to be made is that as we look at the equity, instead of just adding new licenses for delivery and on-site, it would just be great if we could address that with the other licensing structure. That I don't know if you've looked at that at all, but how could we address that with the current structure that we have, instead of continually having to add more licenses, because we think the equity issue is a real issue. And we appreciate that you're looking at the saturation issue, because as you all know, that most of those marijuana businesses are located unfairly in the neighborhoods. There's tremendous density in the very neighborhoods that have the most disparities, health and injustice disparities currently. So again, we really appreciate your work. And, if there's any way we can help, we know a lot of people are really worried about this. Thank you.
Okay, Nancy, again, I'll promote you to a panelist.
Okay, thank you very much. In the beginning of your presentation, you had mentioned that, with making these changes that you wanted to be cognizant of the burdens and unintentional impacts on the community. And those of us in highly saturated neighborhoods like Globeville and Elyria, Swansea, we have lived with the unintentional consequences of the original rollout on marijuana businesses, especially the retail businesses. And so again, I'm going back to these social impact plans, putting the burden on neighborhood groups to monitor and evaluate whether the marijuana business has fulfilled their goals, puts an overwhelming burden on neighborhood groups who are working diligently on many issues. And so I know from experience on this that the CEPs didn't do anything really. I mean, they weren't as effective as Rafael Espinoza had hoped. And how is this SIP going to be any different from the CEP plan? It'll just be, paperwork that is filed by the marijuana businesses. And I found that out with a couple of our businesses that we had in Globeville. You have to go out and do the research when a marijuana business says, oh yes, I'm supporting this organization in the community, I'm supporting that organization, I've done that. People can write down whatever they want if it's not checked on. And to expect people in neighborhoods who have families, who have jobs, who have, and again, are trying to be responsive to other neighborhood issues, to take this on, and it's just very unrealistic and it's unfair. So, hey, you could just about abandon the social impact plans if there is not some regulatory body checking on that, instead of leaving it up to someone in the neighborhood to do that monitoring.
Thank you.
Thank you, Nancy. I can address a couple of concerns just for information purposes. I think you had asked a question earlier about whether the RNOs will receive the social impact plans, and the answer is yes. It's something that will go out standard with any time a new applicant submits their application. The RNO is notified of the application and the scheduling of a needs and desires hearing. So the idea would be that this social impact plan would be an automatic attachment included in that notice packet. Additionally, the department has talked about putting together resources for RNOs on how to read the social impact plan, what to look for when they get that packet. And you know, we've talked with several RNOs and provided trainings on, you know, what to do when you get an information packet about a hearing, how to read it, who to talk to if you have questions, where to look if you need to clarify anything. So if you or any other RNO leaders would like to set up a training for that type of session with your RNO, we're happy to do that. Just email us at marijuanainfo@denvergov.org. Another thing that I wanted to discuss here, just as a resource for RNOs, if there's a community that is experiencing a problem business, a licensee that, you know, either is not abiding by a good neighbor agreement or is not responsive to complaints that are being addressed by the department, there is always a mechanism for requesting a renewal hearing for that license. And that's a procedure that, you know, if you want more information about, again, email us, we can talk you through it. But essentially, it's a process in which you get 15 signatures of folks who live in the neighborhood to request that type of a hearing, and the director has the discretion to set a hearing on whether that license is renewed. So if there are problems in a neighborhood, you know, we do take those seriously, and you know, we can't do anything about problems that we don't know about. So you know, please feel free to use that 311 line to email us, to be in touch. And if there are shortcomings that you see with or problems with a licensee, that is one of the options available. So just wanted to mention that.
So it looks like, Nancy, you might have your hand raised one more time. So I think we can take one more comment from Nancy, and then maybe we can answer a few questions in the Q&A, or see if there's anybody else that has.
It's hard to have a discussion, I guess, in this forum, and maybe this isn't the forum for a discussion. And so, Erica, thank you for your response. Those of us who have been in community on the marijuana issues for years, know about how to read the information that comes from that's sent to us, okay, about when there's an application or a renewal. So, you know, that's great maybe for some people who are new to that. So I just wanted to clarify that. And those of us who have gone through the needs and desires hearings are pretty weary about the process and the intensity and the time, again, that it takes for people in community who are already very, very active in other community issues to be, you know, to be going through the process that is being set up. So again, it's just, I just think that it's a formality to have those SIPs or CEPs. If you could prove differently, I'd love to see it. But anyway, we'll look at it when things get sent out, that's for sure. But as far as the monitoring of it after they get their approval, I don't think that it should be that we should have to calendar in our calendars a time to go back and check on a marijuana business to see that they have fulfilled whatever they have promised and filled out during their licensing request.
And thank you, Nancy. I think that is great feedback and good information. And I think that, you know, some of the information that Erica shared is we don't want to put too much burden on the community either. And there is an opportunity through our renewal hearing process so that if a business is creating issues for the surrounding community, that there is a mechanism to be able to request a renewal hearing in which that evidence would then be brought forward. So a couple of questions that I think are, and there are quite a few in the chat, and some of them have already been answered. So feel free to go ahead and take a look there for some of the questions in the chat that were answered. But a couple more that I think I can answer somewhat quickly are, and I'm not sure who some of these are from, but one of them was around why we're removing the density and location cap, and that location cap is protecting neighborhoods from oversaturation of marijuana businesses. And so I just wanted to clarify that while we are proposing to remove the lottery process for how licenses are distributed, excuse me, we are proposing that we will maintain the protection for those neighborhoods that do have higher density of locations for stores and cultivation facilities. So if there, for those, and this is what's currently in the ordinance language, so if a lottery was to be held, the neighborhoods that have the top 5 number of store locations and the top 5 number of cultivation locations, they would not be eligible for new locations under that lottery process. So while we're proposing to remove the lottery, we're replacing that with exclusivity for social equity applicants, but maintaining the protection for those neighborhoods that have a higher concentration of marijuana stores and marijuana cultivation facilities. And so that protection will remain in place. And then one other question that I think I can address quickly, and a couple of people brought it up in public comment, but also was put into the questions, was around edibles. And I think there are some protections in place at the state hospitality requirements as far as minimized sales. And so there are smaller amount of sales that will be, smaller requirements for the sales that happen through hospitality and sales locations. But our current draft proposal does not make any limitations on the types of products that would be able to be sold and consumed beyond what is in the state limitations. And so the sales limits would be consistent. However, the current proposal does include that edibles as well as smoking and vaping would be able to occur at those hospitality locations. So I don't know if the other Abby or Erica, if you guys have read through any of the questions in the Q&A and feel like you can answer them, but those were 2 that I kind of picked out quickly.
One about mobile hospitality. Mobile operations will have smokers on board. How will drivers be protected from the impact of smoke? That's a really great question. It's addressed in the state rules about hospitality. The state did some really extensive rulemaking on requirements for ventilation for mobile hospitality businesses. So there is a requirement that there's a divider between the driver's area and the passenger area of the vehicle, such that it limits the amount of smoke that can pass through into the driver's vehicle. And I can look up that specific rule language, and we'll add that to the written Q&A just so that everyone can see it.
And then I think the question right after that was around mobile operations and where they would be able to park. And there will be some limitations on the time limit of how long they would be able to stop in one location while still allowing for consumption to be occurring. And then there are already limitations on where they would be able to go, just like another type of tour bus, or there are a private alcohol consumption, a private tour bus where alcohol consumption is occurring. There's limitations based on zoning requirements and those types of things of where they would be able to stop and park already in place. And so we'll be making sure that those protections are already in place. And then the question in the chat was, if a guest leaves the vehicle and smokes on the sidewalk in front of a private home, so that is public consumption that is still remains illegal and would be subject to citation. So I think we can from here, unless anybody has any other questions and they want to raise, or any other public comment that they would like to provide by raising their hand, we will make sure that we get the answers to the questions that are in the Q&A. We want to make sure we answer them thoroughly and provide all the best information that we can. So it's best for us to kind of put those down in writing, and we'll make sure that those get posted in the Q&A that's online.
Hey, Molly, and I just want to say thanks to everybody for these great comments. And I appreciate what I heard from a lot of people is that you were really supportive of the equity piece, which is great. And then really, I've really heard, a lot of comments about the youth protections. And that is one thing that we have really fought, we're really fighting for. We've really stuck by with the proximity restrictions, with the restrictions on advertising. So to hear your concerns in that area is really supportive of us and what we're doing. I see Michelle Helene, she was on here for a little while. She might still be here. She is from DPS, and she served on our committee. And I know a lot, I see a lot of individuals from Smart Colorado on here. They were on the committee too, which was really helpful. We also had a lot of public health representatives who helped us with it. So really appreciate those comments. I had one other thing I was going to say. Oh, and I was just going to say hi to Nancy because we haven't seen you in so long. Thank you for your great feedback. And we hear you on the CEPs, which is why we've, tried to make a change with these new SIPs versus CIPs. So thanks, everyone. I feel like I really learned a lot and got a lot of great information. Thanks to the team for your in-depth presentation and answering all the questions.
I did see one additional question that I wanted to address. Somebody asked about worker protections for folks who, it's not quite clear from the question, but maybe in delivery or hospitality who might be exposed to the effects of the smoke and or consumption. And there is one feature of the delivery that I wanted to point out that's at the state level, and that's that there does need to be an adequate partition with sufficient ventilation to ensure that folks who are working in either the mobile hospitality, well, especially the mobile hospitality, but additionally the brick and mortar establishments that, if they can be able to be shielded from the effects of those who are choosing to consume. So no one's forcing any of those employees to be working in an environment that they're not comfortable with. Just wanted to add that. I saw that in the Q&A.
And I'll just make one more plug for, as Ashley said, all of this feedback is extremely important and valuable to us. And so there is the written comment form template that's on our website. And you can also always send an email to marijuanainfo@denvergov.org. We're happy to come to an RNO meeting to do a presentation or schedule any additional time with any stakeholders that want to just hear more, learn more, or ask additional questions. So feel free to reach out individually to me or anybody on the call tonight, any of the team members, or to the Marijuana Info email, and just let us know if you want us to sit down and talk with you anymore.
Or if you heard too much from us. So yeah. But thanks for being here. Thanks for spending your evening with us. We really appreciate it. It was great seeing everyone. Thank you.
Thank you.
Bye, everyone.